it's my top priority is expanding the capacity of our ability to make not just Mounjaro, but other drugs like it in our pipeline to meet the challenge here, which is a great opportunity as well, of course. People are frustrated when they can't get their medicine. We understand that, and we're going to fix that problem.
That was Eli Lilly's CEO David Ricks on Mad Money last night, talking about the diabetes drug Mounjaro, which is expected to be cleared soon to treat obesity. Positive trial results for a similar medication from Novo Nordisk helping boost that company, both companies, I should say, shares yesterday in a very big way. But researchers are also exploring whether the drugs can help prevent cognitive decline. Joining us right now is former FDA Commissioner Dr. Scott Gottlieb, also CNBC contributor, serves on the boards of Pfizer and Illumina. Let's talk about it. There's so much to talk about with these drugs, but let's talk about this cognitive decline issue first, which is how promising you think that component part of this may very well be.
Well, look, it depends on what you think is driving the benefit in trials like the one we saw yesterday. There's 2 trials underway right now by Novo looking at the potential benefits of these drugs in treating Alzheimer's disease, slowing the cognitive decline in Alzheimer's disease. When you see a benefit like the one we saw yesterday, where you saw a 20% reduction in the risk of cardiac outcomes, either heart attacks or strokes, in patients who already had a history of MI or stroke. So these were patients who already had a significant cardiovascular history of past events. You start to wonder whether the benefit that you're seeing in those studies is being driven entirely by the weight loss that these drugs are inducing, or whether or not the drugs are having a broader impact on things like metabolic syndrome or perhaps inflammatory mediators. And if you start to believe that these drugs are having a broader impact on overall inflammation in the body, for example, then it does become possible that these drugs could affect things like cognition in Alzheimer's disease. And so I think when you see results like yesterday, it starts to make you wonder whether or not these are having benefits beyond just the immediate benefit from the weight loss.
Scott, do you have any concern about the long-term side effects of these drugs? And I asked because there are folks using these drugs that very well should be using these drugs. I mean, people who are genuinely obese and have other issues where this is very, very helpful. And then there's a lot of folks that are starting to use these drugs, as you know, from a vanity perspective. But hearing this type of news may start using or think they're using them for more than a vanity perspective.
Yeah, look, I think people who use these drugs need to be properly indicated for them, and I think these drugs need to be carefully evaluated in the indications that they're now being potentially used in, where it's not going to be just transient use, but it's going to be use in perpetuity. If you're using it for weight loss, when you come off these drugs, in many cases you'll regain the weight, and so patients are going to remain on these drugs for long periods of time. Remember, we have a lot of history with these GLP-1 agonist drugs, but it's in a setting of diabetes where the dose is much lower. Typically, the dose used in weight loss is about 4 times the dose that historically has been used in diabetes. So at these very high doses of these drugs, we don't have as much long-term data on use. And there is evidence to suggest that it does things like causes loss in lean muscle. So it does have effects on the body and the body habitus that could be detrimental to some people. So I think we need to make sure that we properly study these. The companies are doing that. Novo, for example, where we started out, is doing a large trial in dementia and Alzheimer's. It's going to read out in 2025. I think they started that in 2021, so it's a long-term study. And the study that read out yesterday looking at the cardiovascular risk was another large long-term study. It involved 17,000 patients, 75% of whom had had a history of a heart attack, about 25% had a history of stroke. So I think the companies, both Lilly and Novo, are doing a good job undertaking large studies to look at these potential benefits and the risks.
Dr. Gottlieb, I'm wondering is there another example of a drug that's been, approved for another indication at much lower dosages that are then used for different. I'm just trying to understand, why there isn't more concern about the high dose, because theoretically the doses keep going higher and they may reach a certain point, but you're taking them for the long term. And so we don't really understand, do we, the side effects potentially of taking these very high doses for years at a time, for maybe a decade. We won't know it until it actually happens at this point.
Yeah, look, it's relatively new that we see these drugs being used for weight loss at higher doses. And so the companies are continuing to track the patients that are enrolled in these studies, looking at the long-term potential sequelae from prolonged use of these drugs at high doses. So I think we're going to have a good safety database. But you're right that utilization is sort of outpacing the collection of the data, and you are seeing some health authorities, particularly in Europe, starting to look at potential side effects with prolonged use. I think we're going to know much more as use continues to grow and as these trials read out. but you do have to wonder whether or not keeping patients on these high doses in perpetuity isn't going to have some health risks associated with it. And that's why it's important to make sure people who get put on these drugs are properly indicated and have significant risk factors where the weight loss that they're achieving is going to help their overall health status.
Scott,
Certainly the trial yesterday, I think, was that case.
In truth, though, right now, given what you know, at least anecdotally, do you think it's being prescribed properly? Given that the growth is I'm not sure, is coming strictly from folks who are obese, right?
Yeah, look, when you look at the overall data on utilization right now, about 5 million prescriptions were written last year. It's going to be up this year. It's a little bit more than about 1.5% of the population. Probably on BMI alone, upwards of 40% of the population is indicated for these drugs based on risk factors and BMI. Certainly, we're not going to get at those levels, but I would be surprised if the data continues to show positive outcomes if we get in the high single digits of utilization. To put that in perspective, about 20% of the American population is on statins. So I think overall, it's being used appropriately. I think on the margins, there is some inappropriate utilization where people are just using it, for more of a cosmetic purpose. I think that's largely anecdotal. It's probably in a lot of our social circles here in New York City. So we're seeing more of it.